For a long time, statistics have indicated that infant and child mortality are a big health concern in Uganda, with the leading direct cause being poor sanitation and hygiene. To reduce the number of children dying below the age of 2, World Vision intervened with a pilot project dubbed Babywash in Hoima and Kikuube districts, Western Uganda.
The Babywash project came in place because of the missing link of addressing the whole continuum of care that is involved in the well-being of a child and the mother. Now, the Babywash project has been implemented in Hoima and Kikuube district in 5 health facilities, that is in Kikuube Health Center 4, in Wambabia Health Center 3, in Parangasi, in Buraro Health Center 3, but also in Mukabara Health Center 3.
Key in focus was the first 1,000 days, which is a period of rapid physical growth and accelerated mental development. This is the time from pregnancy, labor and delivery, newborn period, complementary feeding, and throughout a child's mobility. The period gives a unique opportunity to build a lifelong health and intelligence of the child. It's a few minutes to 10 a.m. and Akungizibe Judith arrives with a friend at Buraro Health Center 3 for her routine antenatal.
We implemented a health program where we had a lot of engagements promoting health-seeking behavior, including mothers going for antenatal and postnatal services.
Hano hairwaro lyaitano habaira haroho okubonabona muno ahabwembera etali nungi ya hairwaro hano abo kubanya bankazalira abana babiri baito okubanza nkafunamo obuzibu bw'okubonabona ahabo butabaho n'ebitabo ebikumara n'amaizi tutalina amaizi buyambi bwona bwa amaizi twabanzaga kuleka hano banyakazaire nitugaruka muka kutabale domoro ntugenda amaziba go waitu obundi ntubitekamu na boda kujja kukyana amaizi gokogeza nyakazaire.
Before, it was difficult to attract professional medical workers to work in many of these health facilities as they lacked essentials like proper maternity wards, water and equipment.
Habo kuba nyoni nzara ogo mwana wa kabiri hakaba haro ekitabu kimu kyonka obu wamaraga kuzara haizirondi o ainenda nawe najja kuzara nibabanza nibamubyamya ahansi nibamwalira nosera omukeka borata izire nagwe nogura no mubyamya ahansi.
"75% of neonatal deaths occur in the first week of life. A case in point was in Wambabia.
We used to get something like infections, maybe someone comes back with an infection of the cord, but I think it would be as a result of sleeping on the floor after delivery.
At 8 months, infant locomotion is every mother's unmitigated joy. Panic sets in when a child can't crawl or doesn't connect with people and things around them. This is more awful in rural settings where parents lack appropriate knowledge on child care and is key on the implementation plan of the Babywash project. Joyce Kahwa, a VHT in Chabingambire sub-county, is going about her routine. Top on today's agenda is to meet breastfeeding mothers to train them proper child growth. Through her influential and respected voice, Joyce encourages them to plant green gardens because she believes that proper nutrition is crucial to a child's growth.
Ntubegese ebyobwomezi kandi nebyendia
n'ebyokuba ngu bwabaho kurungi hata hali ebyendya tubegesa nk'abakazi abalina enda kulya ekibule kijwire kandi baba nibekamba kuteekawo obusiri bwe mukubye kwiragura habwokuba omwana arolerwa kuruga kyalo munda tubala ebiro 10 ebintu by'omwana kyolekeza kiki ekyaliba mbusibu bwo maiso mukazi wenda inakulya kurunge kibule kijwire ebyokulya byenganda 3 byona biro bikuleta amani bikombeka omubiri nebikutangira endwara nuko omwana asobole kora kuba kurungi omunda ko mukazi ebyale nibyo biyamba omwana omunda.
Through our livelihood project we had promoted growing of food and they had increased the food production, but the feeding, the utilization of this food, the way how to prepare this food so that it retains the nutrients was lacking.
By making clean water, sanitation and hygiene services available, great strides have been made.
Babywash has really promoted the hygiene and sanitation and access to potable water, water that is clean and water that is enough in the health facilities. We are seeing hand washing being promoted, through Babywash and the water access that has improved in the facilities, where we are seeing in the maternity, mothers and the health workers' behavior of hand washing has also improved, because before even the health workers themselves were not washing hands at every critical point of care.
The community also received water, and this water did not end in communities only, but it extended also to schools. In the schools also we achieved that. It is a good achievement to the department, because the girls, when they are changing their pads, they need to have also water in the schools. The communities also have improved. Especially with the COVID era, they are washing now their hands after toilet. They are washing hands upon shaking each other, and in totality, the community has improved.
We have had investment in Mukavara peptide system of over 300 million. We've had investment to Wambabia peptide system of over 600 million. We've had investment done to Kikuube Health Center for peptide system of over 700 million. All this is to increase and improve on the water quality and sanitation within the area of Kikuube as a whole. This also improves on the resilience to COVID-19.
We are now clean. Our environment is everywhere is clean. We can wash our clothes. Even the facilities now is looking clean. Even mothers are able to access water to wash their utensils and their equipments.
We make sure that all health workers have access to PPEs. They are doing appropriate waste management, right from the handling up to the final disposal.
Now, at some point we had the minister even coming, saw and said, no, this theatre cannot be used for operations for humans. You don't have water and you don't have the infrastructure itself. It's not in good state, no. Now it was improved. Water was placed in, was connected to the facility, and we even did a cesarean section within the theatre.
And this has also increased on the number of mothers and even patients in the outpatient department. There has been an increase of patients because of the services which are improved due to this project of Babywash.
Because every department is having water. Even they are outside in the bathrooms, toilets, there is much water and it is accessible at any time.
Babywash has contributed a lot in the improvement of hygiene and sanitation, not only at the facilities, at the health centers, but also at the household level. We are seeing a lot of improvement and change in behavior. When it comes to hand washing, we are seeing mothers now they have promoted and changed their behaviors, like washing their hands before preparing food, before breastfeeding their children, after cleaning the feces of the baby, and all other critical points.
Water is the one we use for the patients who come into the facility. And now, I will still bring back the same thing at some point. Take it that there is no water. Because water, it's all rotates around water. Really, rotates around the water there. Water, you have it, you can wash your hands. You have the water, patients can wash their hands. You don't have the water, you don't wash the hands. Even if you sanitize, if you have visibly dirty hands, it's not useful. So in the end, it still comes back the same thing. The water, it's so helpful.
Turetire birungi bingi na muntu munonga kabyo buyonjo ebyo buyonje ebyo bikaba bitubereye bizibu tutabimanyire shonka ko ya project yizire etwegesize ibintu byo buyonjo munonga norebana muno butandaro tubwine tukatutegera butandaro ebyogero tukatutabigera tukatutamanye n'umugasho gwabyo tukaba tutine koko turi kubasa kutekaniza imisiri yitu tutina mizi chokata mizi turarimenyanya tureyambisaga mizi niko kari kutuyamba ebirimo byitu n'ibirungi norane nyine mpunu hano nyine mbuzi nyine nkoko chonka amizaga nibwo ndi kweyambisa abo akugata akabatari chonka tubwine mu bwingi obuyonjo twine obuyonjo kurungi twine kizibu cyona
ati Babywash katuyambira kimu bura abantu bakaba nibarwara bine byoburofu hatwara bamwe abantu twabegesa tomuntu akusemera kunabo mu ngaro buli bwire bwona bwakaruze mu ngaro bikozereke ziraguyire.
Babywash has reached out to a population of over 105,358 in Kikuube and Hoima districts, including over 7,000 children under the age of 2 years, in addition to over 97,456 pregnant mothers who have been reached with appropriate WASH knowledge, including maternal child health, nutrition. And we believe that with the provision of drinking water points at the health units, this will not only help mothers but also health workers to access safe water.
When it talks about availability, increasing access to basic water at the health facility itself, we have made sure that we have water that is available in both the right quantity and quality. When it talks about the quantity, we are making sure that the health facilities have water that is connected to all critical points of care.
This is such a huge innovation move that has been socially acknowledged, and there is hope in seeing the improvements that the investment will bring to the community as a whole.
As you know, our budget as government is not forthcoming to reach all that far you brought us. I would pray that if possible they would come and also help us in other areas. Since we have reduced disease burden there, if they could also shift to another sub-county or other health facilities, we would be really grateful, especially the health center for Chigorovia. Would be very grateful. And all those health centers where it is hard to reach, where the mothers really take a lot of time to reach the good facilities.
Of course, the government gives us primary health care funds, and this facility is accredited for result-based financing. And actually, our monies for RBF are increasing. And actually, I want to say it is because of the Babywash project, which has kept us and the mothers delivering at a high rate. Like in a month, we are getting between 40 to 56.
We used to have less than 2 or 1 per day, but now a minimum of 2, which makes about 60 deliveries per month. This has been a very good achievement.
And I'm sure we shall go even to 100.
That's how, as a district, we have come in to put up the area service provider has been the Kikuube Primary Cancer Station. In some areas, we are also working along with the Midwestern umbrella to ensure sustainability of our water facilities.
And the community also was empowered, was given knowledge, whereby they have already accepted to be contributing to the operation and maintenance of water system.
Kuba amezi batugamba mizi nibwo bwo mezi. Aha mizi gatari tuba kurungi. Shonka wa division ruhanga ye bari okubahereza ekitekerezo kugira ngo batuyamba batwirukira nk'abantu bawambaza.
Nabo cyo tukubasima muno tutayina kugarukira. Mwebale muno omulimu gumwatukoleire mwebale kutuyamba.
Ego tukusiima muno World Vision kine kyetukolire mparanga sairo watu tuli kubi muno hate omukazi rundi nazaara omukazi namara kuzaara ndazaire kiro obwire ne bukyata nabire nakimu amaizi gabuzire kandi tugisaba burayongeza ino mbyale binde biri harayiraho tujja kutera muno mu ngalo tungera kusiima